I practice in Pawhuska, Oklahoma, which is basically rural Oklahoma northwest of Tulsa. My patient population is primarily working class, probably primarily blue, what would be considered blue collar working class. There's certainly income, there's certainly employment, which is good, but the monthly budget doesn't always allow for dentistry. In today's world, it's all about options. The consumer has more control than ever, and they want to control when they do things, they want to control how they pay for it. If you're the kind of guy who limits people's options, your options get limited too. So I think that it's just another way to be a team player and kind of understand how to make people's medical and dental treatment fit with their life. When I first heard about it, it was kind of automatically the right thing to do for me, just because this conversation about financing is a daily conversation in my office. It just made a lot of sense, especially when we looked at how little the traditional third-party guys were accepting our patients. They say 50%, but our patients were being accepted about 10 to 15%, I would say, through the traditional process, and that kind of reflects maybe on income or whatever factors go into that. And so that was kind of disappointing for us. And we had even tried our own in-office financing with mixed results, but this made a whole lot more sense to us because it was a way for us to do in-office but not really take as much risk. I think that there's much less risk actually having compassionate healthcare be the primary financer. The biggest concern I think a lot of patients have when they talk about financing is they're afraid they're going to be declined. They're afraid they're going to, in public, be told you're not good enough to do this. The biggest sort of emotional turnaround for the patient is when they hear like, okay, we're going to get this done, you're going to get your tooth fixed, it's going to be good. It's really nice. If the patient walks out the door, there is no risk, but there's no reward at all. You're 100% not going to do the dentistry. And when you look at, even if the repayment rate was in the low 70s or even 60s, the reward is still much better than the alternative. And the other thing that I think a lot of people don't think about is the goodwill that's created in the community.